Okay, it's like okay, Assalamualaikum and good night everyone. I hope all of us are doing fine during this pandemic. So we are back in the new semester with the same host, me myself, Ainina Azman, and my partner.
Najia Najmi.
So you are now watching Girls Out Loud.
It's all about girls thingy.
All right, I want to say that time flies very fast because without us realizing, Girls Out Loud, which is one of the production under IIUMTV, has now comes to its sixth season for this semester. So for those of you who just come across to our show, Girls Out Loud is actually a show about women, particularly discussing about health, beauty, fashion, and so on. But then men are also encouraged to watch our show so that they can learn about their mother, sister, and cousin in the future.
Yes, that's true, Nina. For this episode, we will be discussing about the myths and facts of dysmenorrhea, or in other words, period pain. I believe that this topic is very much relatable to our female viewers, and I'm sure they're excited to learn more about it through this episode. And with us to discuss this issue is our guest, Dr. Maiza Tusimin. She's an OBGYN at the Prince Court Medical Center and was a lecturer at the Department of Obstetrics and Gynecology from University Putra Malaysia's Medicine and Health Science Faculty. She's also a column writer for magazines like ISEHAT and Pharma. So, Assalamualaikum, Dr. Maiza. Welcome to the show. How are you?
Waalaikumsalam. I'm fine. Thank you so much. Thank God. I don't have patient in labor tonight at the moment. All right. Thank you so much for inviting. It's quite, overwhelming when I have students inviting me again. Not stopped. I mean, I was a lecturer last time in the University Putra Malaysia in the Faculty of Medicine and Health Sciences. So I hope my students are watching this so that they can revise back the topic on dysmenorrhea. That's what we're talking about tonight, right?
Yes, that's right.
Okay, so without further ado, let us come to the first question, which is about the definition of dysmenorrhea. So, doctor, can you tell us what is the meaning of dysmenorrhea basically?
Okay, dysmenorrhea, or in layman we call it as period cramps, period pain, right? Anything got to do during the menstruation phase. Okay, it's not like PMS. All right, PMS is totally different. When we talk about dysmenorrhea, it is related to pain. All right, pain during menses, as simple as that. So you have actually two types of dysmenorrhea, either primary or secondary dysmenorrhea. Later I will describe a little bit furthermore on that.
Okay, so basically, dysmenorrhea is about pain, which is totally unrelated to PMS, and there are two types. So actually, what are the factors that leads to the occurrence of the dysmenorrhea? Is it because of our genetic or lifestyle or the foods that we consume, or is it just by natural process?
Okay, that's why earlier I explained there is two types of dysmenorrhea. You have primary dysmenorrhea, or the other one is secondary dysmenorrhea. So when we talk about primary dysmenorrhea, that means there is no related gynecological or any pathological related to our pelvic organ or reproductive organ that cause the pain during menses. Okay, that is purely primary dysmenorrhea. But when you have some disease, for example, like endometriosis, adenomyosis, or some pelvic infection, then we call that group as secondary dysmenorrhea. So during your menses, basically your uterus is trying to, contract, all right, by the action of, there's a chemical substance, we call it prostaglandin, all right, in our system. Actually, men and ladies also have this prostaglandin and thromboxane. Okay, it's supposed to be balanced, especially in ladies during menses. Okay, we focus on more on prostaglandin. So prostaglandin act on the uterine, muscle and making it contracting, trying to, how to say, squeeze down the blood, all right, during menstruation. So this actually causes the pain. This is the physiological changes. And during menses, all right, it's actually quite natural to have a little bit of pain. But later we will discuss how bad is the pain for you to need to go to see a doctor. All right, eventually when you had your first menses, probably somewhere around 12 or 13 years old, this is an average age where you will actually attain your what we call as menarche. All right, first time having menses. Initially you'll be okay, no pain, but between 6 months to about 12 months, then you will start experiencing a little bit of cramping during menses. Okay, it occurs usually during the first day until about day 2, day 3 of menses. And then as your menses sees down, the flow, what I mean is the flow is getting lesser, not so heavy, then the pain will start to reduce down. All right.
Okay,
Is
so
that clear?
yes. Okay, so the factors that leads to this dysmenorrhea is first, if it is primary, then it is just happen by natural process. Like we don't know
Exactly.
what is the reason, but then if it is fall under secondary type, so it may be caused by the contraction, like it is related to endometriosis and other type of illness, right?
Disease.
Okay,
Yeah.
so
Primary, no
uh,
disease. Secondary has got disease related to it.
I see. Okay, so
Primary
doctor,
usually the disease. Huh?
is it actually normal for women to feel that severe period pain when they are suffering from period pain? I mean, in normal menstruation phase, is it normal to feel that severe pain?
That pain. Yeah, I can understand that. Now, basically, 8 out of 10 young ladies will have this so-called pain, all right, or menstrual cramp, dysmenorrhea, and majority is actually primary dysmenorrhea. There's no disease related to it, neither
Mm.
endometriosis, adenomyosis, or any pelvic infection. No, they don't have that, or any uterine anomaly. They don't have that. It's just purely because of primary dysmenorrhea, no reason behind it. All right, it's just the physiological changes that happens during your menstrual cycle. Okay, so that's quite a lot, right? 8 in 10 ladies. Okay, and usually by when you are more mature in terms of your reproductive function, more mature, that means around 18 years old and above. All right, most of the time this pain will start to cease down. All right, usually by around 22, 25, you don't really have this kind of period cramp. Okay, but if you still do have it and the score is more than 5, so we usually score the pins, all right, from 1 till 10. This is the pin score, all right. 1 means very, very minimal. So you can divide 1, 5, and 10. 10 is very, very severe to the extent that you might not be able to go to school. You need some injection as a pain relief, perhaps, you know. Some even very bad that they actually vomited and need to be hospitalized. Some actually fainted because of the pain. Okay, so that is really, really bad, and your parents need to bring you to see a gynae at least. Okay.
Actually, talking about this pain, I think I had experienced this once when I was 18 years old. And
How
then
old are you
actually
now?
I'm having class at that time, but then I really tired and I cannot go to the clinic to get an MC or what. So I just rest on my bed without going to see doctor. And then yeah,
Yeah.
after that, it never occurred to me like the pain is never I never suffered that pain anymore. So yeah,
Yeah,
as I get older,
at least you're
I
very
have not.
lucky.
Yeah.
Yeah. Okay. So and like I've got like 2 teenagers daughters. They're actually quite okay. They don't have this very bad menstrual cramp. Occasionally, one of them have, but not every month. You know, certain month. It does relate to the way you take your food. You know, the choices of food,
Mm.
because we know that a
Mm-hmm.
lot of food are actually, how to say, inflammatory food. You know, they can induce inflammation. This is what happened in ladies with excessive period cramps, you know, a lot of
Mm.
inflammation occurring around the pelvic organ. All right. So the way they take the food, you know, too many sweet things, too many sour things, that is not good actually. All right. Basically, you have to go for suku separuh. One third and half. So one third protein, one third carbohydrate, and half is actually your vegetable and so your fruits. All right, this is more balanced. Then you modify all this and your lifestyle, the way you how to say manage your stress is very important because this is also related to dysmenorrhea.
Okay, so basically the food that we consume really affects our pain lah, whether it will comes to us or not. So we have to eat balanced meals.
Diet. Yes.
Okay.
Yes.
Doctor, since we are discussing about dysmenorrhea, I would like to take this opportunity to promote a campaign by students from Kuliah of Economy in IIUM, where this campaign is called Merah Movement, where it is basically a fundraising activity for a woman who suffer from period poverty. So the aim of this campaign is to give free pads to 15 big families where the women are suffering from period poverty. So this campaign will be launched on 1st April 2021. So to know more about this campaign, please follow the Instagram Merah Movement. Okay, please follow Instagram Merah Movement.
Yes, guys, you heard that right. So please support this cause because I believe that it is very important for us to acknowledge that there are people out there who don't have the privilege as we do. So let's move on to the second segment of this show, Fix or Facts. So, Doctor, I would like to know. Oftentimes we hear about people saying that we should avoid eating cucumber or drinking cold water because it will affect menstruation. Do you think is this true about
Okay,
this?
when you ask the doctor, the doctor need to answer in relation to evidence-based medicine. Okay, not so-called how to say all this ancient story or from grandmother's story. No, we have to rely on evidence-based medicine. All right, so everything is clinically proven. So when you talk about what you say just now, cucumber, right? It's
Yeah,
actually a very
cucumber.
good source of antioxidant. Okay, sir, it's a how to say it's a vegetables, right? So it's a
Yes.
very good source of antioxidant, vitamin C, folic acid. It's actually good for patient with dysmenorrhea. Okay, and having cold water. Yes, I do hear a lot, especially from my Chinese friend or my Chinese student. Okay, they say when they are having menses, they don't take cold water. Okay, that can actually worsen the dysmenorrhea or can actually cause the menstrual blood to stop flowing. So this is actually not true. All right, it doesn't work like that. Okay, you can take any. I mean, this is my personal opinion and also based on evidence. There's no harm for you to take cold water during menses. Okay, I don't like hot water. Okay, even very pantang, I curi-curi. Yeah, occasionally I will take cold water. All right, provided it's plain water. If you take very sweet cold water, for example, some colas or caffeine with a lot of sugars, of course that would not how to say that would even cause more harm than benefit. If just plain cold water, frankly speaking, it doesn't cause any harm to your menses. All right, so do not worry.
Oh, because to be honest, I'm one of those people who believe these things, and
I
I would
know.
specifically avoid drinking cold water because I'm like, oh, what happens if my blood stops flowing? Will I get more cramps? Usually, I don't really get cramps, but I'm scared that if I drink the cold water, I will get the cramps. So I would avoid it. But it's good to know that it's not true. Alhamdulillah, I
Yeah,
can drink water now.
it's a
So
okay. It's not facts.
true. It's just a myth, right? Okay, so the second question that I have for you is that other people would say that sour food can stop
Mhm.
menstruation. As you mentioned before, it's not good for you, but will it actually stop the menstruation?
Okay, that is really non-healthy food, basically.
Mhm.
Too sour, too sweet, too salty. We have to take everything in moderation, and by right, it's supposed to be a balanced diet. Okay, but anyhow, to answer the question, it's not true.
I understand.
It doesn't affect the flow whatsoever unless you've got underlying medical condition. Okay.
So it's not something that we should avoid. We can eat freely, but in
Well, if it's not
moderation, of course.
if it's not healthy, then don't take it.
True.
Like junk food.
Oh, yes, it's in the same category, right? So,
Exactly.
what about painful periods? Are they related to signs of infertility? Can you give us a little bit of an explanation on this?
Yeah, I think nowadays young ladies or what we call as adolescent groups or our teenagers are more alert. Okay, and because everything is at the tips of finger, all this information, they just can Google around or scroll down the IG. And having said that, if you have very bad period pain, a lot will actually relate to endometriosis. Okay, so to be frank, actually, it will take about roughly 7.5 years to even diagnose this endometriosis, especially in adolescent age group. All right, usually we always go
Oh,
for primary dysmenorrhea, but of course, we need to do certain investigation to say that this is actually primary dysmenorrhea. All right, it's not related to any disease. Okay, but I've seen a few patients basically. I've seen a lot of patients with dysmenorrhea, and majority are actually primary dysmenorrhea, where we can actually treat as simple as home remedy and also over-the-counter painkiller, which is actually very safe. All right, and we don't take the painkiller all the time. We just take it what we call as cyclical. That means only during the heavy menses or the time that they are having the pain. All right, so it's not really constant. Okay, only during the usually day 1, day 2, day 3. All right, of your menses. So you need to keep track of your menstrual cycle. Use the apps. All right, to keep track of your menstrual cycle. That is a very good habit to do, starting from now. Okay, before you start your own family, right? And then there are certain investigation usually when your mom, your parents bring you to see a doctor, even a general doctor outside, they can actually scan you first. All right, on top of having a very thorough history taking, we ask you about all the relevant questions, family history whatsoever, and then we go head to toe examination. All right, then the next step is for adolescent or young ladies, we go for a scan. All right, this scan is done on the tummy. Okay, what we call as pelvic scan or abdominal scan. All right. So based on that, we can actually detect whether you are having a cyst or not, because sometimes a cyst can also cause that secondary dysmenorrhea, cyst related to endometriosis. All right, so it can bring about to a diagnosis of endometriosis. Okay, but very rarely that I see, I would say maybe when we talk about adolescent, 20 or 2 out of 10 adolescent that I saw, yeah, they have cysts. All right, and even about some of them would require surgery. All right, because the cyst is
wow.
significant. Yeah, it's quite big. 5 cm and above. Something is cooking inside there. So, and with the symptom, we might want to consider a surgery. All right. Usually in the management of young ladies or what we call as adolescent group, we try to go as conservative as possible. All right. I don't go straight to surgery. Okay. We go step by step. You go for pharmacological treatment. That means we give some medication to control the pain. If it's not related to a cyst, but there's a pain and a big cyst, then possibly the doctor might want to suggest surgery. Usually we go for a keyhole surgery, what we call as laparoscopy surgery, all right, to minimize the, how to say, manipulation during the operation, all right?
I see. So you mentioned about taking pills, meaning there's medicine involved
Yeah.
for dysmenorrhea patients. Can you
Mm-hmm.
explain to us what are the names and what do they do specifically?
Okay, there's a few groups. Basically, we go as basic as what we call as NSAID or non-steroidal anti-inflammatory drugs. Okay, so these are actually painkillers. All right, we know as painkillers. We can start as basic as Panadol. All right, then you can maybe a little bit upgrade. You have mefenamic acid, which is constant. You have Celebrex, all right, a little bit higher in terms of strength to mefenamic acid. Then later on, you have Acoxia. So all this medication is actually clinically proven to help in terms of the pain control basically, you know. And number two, there are some property about 30 to 50% in this group, especially the mefenamic acid and also acoxia. It can reduce down a little bit of your heavy flow. Right, so two properties. One is the pain relief, and number two, the reduction in the heavy menstrual flow to about 30 to 50%, depends on what drugs that the doctor choose to give to you. All right. So I know there's a lot of parents which is a little bit, how to say, skeptical when doctor want to start a painkiller. All right. Yes, all this drug goes to your liver, goes to your kidney, and in the long run, you might be, how to say, scared that this can actually harm your kidney or liver function. But with, how to say, monitoring, all right, and a correct prescription from the doctor, inshallah, all this would not, how to say, come into the picture. All right, it's actually quite safe to use, and the fact that we don't actually take it every day, right? We take it when the pain is really severe. Okay, that's why you need to monitor your menses. All right, so this
I
is one group,
see.
the painkiller. Next step is the painkiller does not really works, then maybe the doctor will actually discuss with the parents, especially those under 18 years old, all right, to discuss about contraceptive pills. All right, this is hormonal treatment. Okay, the simplest one is actually OCPs or combined oral contraceptive pills. Usually I prescribe YAS, the lowest dose of estrogen, or Yasmin. Okay, so these are actually sisters. Yas has a very lower dose of estrogen, followed by Yasmin, the sister, a little bit higher, but still considered as under the low estrogen group of contraceptive pills. All right, so it's actually quite safe with monitoring. Okay, so
Oh,
these are the two
understood.
tips that we usually use.
Because my friend is also taking the concentrate. I can't spell. Birth control. Yeah. Con-
Contraceptive pills.
yeah, they're taking. She's taking that, and I think it's something to do with her period.
Yes.
So it helps to control the cycle, or
Exactly.
oh,
So
okay. So
I can list down the benefit of contraceptive pills. All right. Number one, cycle control, definitely. That means your cycle will become very nicely regulated. You know, a 28-day cycle. All right, where it's very easy for you to track your menses, your ovulation days, especially those who actually got married, you know, during medical student also. A lot of them actually got married at the final year. Okay, so number one is cycle control. Number two, pain control. That means the menstrual pain control. All right, when your cycle is more regulated, the pills actually inhibit ovulation. So when there is no ovulation, so perhaps the pain is much more lesser. All right, so number two. Then number three, for those who are having very heavy menses, the menses will, how to say, the flow would slightly reduce when they take these hormonal pills. All right, so when your flow are reduced, that means your hemoglobin or red blood cell in the body won't go down, and you don't have anemia, hopefully. All right, if you take the pills constantly with prescription, basically, or monitoring by the doctor. These are among the benefit, okay? And for those who love to have, how to say, clear skin. All right, this is, I'm not promoting Yas or Yasmin, but these are the two pills which actually the manufacturer lists down the benefit, which include clear skin. All right, very nice skin. It helps in terms of acne management, okay, and a little bit of hirsutism management also, and it do helps for those having PMS, actually premenstrual syndrome, right? So these are among the benefit of contraceptive pills. Okay, well, of course, there's so many pills, so you need to discuss with your doctor which is more suitable to you.
I understand. I heard about the clear skin part, and I was kind of
Yeah.
intrigued to try it. But Alhamdulillah, I'm not really at the place where I want, like I need it. So maybe later on, like, inshallah, I will
Don't
take that.
simply take it without indication or monitoring, because the thing is, every medication has got, of course, a lot of benefit, but also the downside. You know, if you miss the
True.
pill, then your period will go haywire. So you need to take it constantly because these are hormones, all right? So you need to take it at the same time every day if possible. If you miss one or two, then most of the time your cycle will become haywire, okay? Then there will be another headache.
Right. So you also mentioned that besides taking pills, there's home remedies, right? So what are those home remedies?
Okay. I think those who really follow me in IG, I always go for these three major or basic element, regardless when we talk about fertility, kesuburan, basically, trying to conceive, or any woman-related condition. Number one, the 3K, basically, try to keep your weight up to date. That means make it healthy weight. All right, I'm sure everyone knows how to calculate BMI, body mass index. All right, keep it at a healthy level. Number one. Number two, keep your diet healthy constantly, suku separuh, wanted protein, wanted carbohydrate, and half is actually your vegetable and fruits, because all these contain a lot of, especially the vegetable and fruits, contains a lot of antioxidant and anti-inflammatory, which can actually helps in terms of managing as home remedy for dysmenorrhea. Okay, the 2K, right? The third K is to keep a healthy lifestyle. That means try to cut down your caffeine. I know everyone is caffeine lovers, addicted to caffeine. Try to cut down to about 200 to 300 milligram of caffeine or coffee per day, which is about 2 small cups, not the big venti size Starbucks. All right. That's number one. If you're smoking, try to stop. Vaping also need to stop. Try to have a little bit of exercise every day, at least maybe 20, 30 minutes of brisk walking per day. That would be good enough. Okay. And among the other remedies, for example, like yoga, Pilates, these are actually very good in terms of helping to manage the pain. Of course, it won't actually cut off the pain 100%, but it can be another alternative apart from taking all those medication. Of course, you can use hot pack, warm pack, on your tummy during that bad days. All right. Try to lie down and relax during that bad days. But of course, if it's very bad, scoring more than 5, to me, more than 5 is severe enough to bring you to a clinic at least, or get yourself a over-the-counter pain relief.
Understand. Thank you so much, Doctor, for that explanation.
Okay, doctor. So moving on to the next question. Earlier, doctor said that most of the patient that you have treated mostly the primary type of dysmenorrhea. But then, if let's
Uh-huh.
say the patient the from the secondary type of dysmenorrhea and it is related to endometriosis, what are
Mhm.
actually the symptoms that we can see that okay, this patient are having dysmenorrhea that is related to endometriosis?
So when we talk about dysmenorrhea, yeah, I usually divide them into three groups. All right, you have the adolescent groups, you have the reproductive age group, and you have the perimenopausal group. Those going towards menopause beyond 40 years old most of the time. So adolescent is young ladies. All right, our teenagers, and reproductive age group somewhere around 22 to about maybe 38, below 40. Okay, so different group would represent with different types of dysmenorrhea. So as I said just now, majority of adolescent is actually primary dysmenorrhea. Okay, those in reproductive age group, I would say almost maybe 8 in 10 is actually having endometriosis. This is from the pool of patient that I saw in my clinic, basically. So my clinic is actually quite specialized, related to ONG and also fertility. So I do see a lot of endometriosis. Just now you were asking in adolescent group, perhaps in your group, age group. Um, Not so many that I see. They are actually in the secondary dysmenorrhea group. They are majority as primary dysmenorrhea, which is very easy to handle. Some a little bit of pain, home remedies advice. All right, definitely. Number two is a painkiller, and some of them would still need help with COCP. That means the contraceptive pills. All right, but of course I need to advise the mother, because sometimes a lot of mom actually quite skeptical when we want to start contraceptive pills on their girls. All right, and one of the things that they would ask me is that would this cause our girls to become infertile later in life? Okay, so inshallah it does not cause that. Okay, and we don't actually put the girls on long-term contraceptive pills, only temporary. So when you talk about secondary dysmenorrhea, okay, again we go by the age group and the aim of the treatment. For example, if you talk about adolescent group, the aim is actually pain relief, right? And number two, if has got a very big cyst related to endometriosis, then most likely that a young lady would need a laparoscopy surgery to try to remove as much as possible the endometriotic lesion, all right, and try to restore back the normal anatomy during the operation, all right. But having said that, we try to minimize the injury caused by the surgery to the especially ovarian tissue or ovaries basically. Okay, because we are born with about when we are in our mother's womb, we have about 2 million eggs. Okay, when we have our first menses, our eggs is only around 300 to 400,000. Okay, and that is our lifetime supply until we go into our menopausal age, which is somewhere around 51.7. That is our menopause. Okay, so our reserve, ovarian reserve, is about that 300 to 400,000. Okay, so we try to minimize the injury to the ovaries. So in patient with secondary dysmenorrhea, because of endometriosis, and they are actually in the reproductive age group. That means they are TTC group trying to conceive. Okay, the how to say, the aim is different. Now it's not only for pain relief, but also at the same time we need to help them to conceive. All right, so that different. Okay, we need to further investigate, and some of them might need a little bit of help to get pregnant, for example, like an IVF or what do you call that? In Malay, we call it bayi tabung uji. Okay, test tube baby. Okay, some of them might need that. So in an extreme group, for example, those already completed family, has got few children and is beyond 45 years old and has got very bad dysmenorrhea. Okay, not just related to endometriosis. There's another group, we call it adenomyosis. It's like a sister to endometriosis. All right. So the pain can be very excruciating to the fact that they can't really function as a woman, as a wife, or as an employer or employee, right? So to the extent during that age group, we might consider a more extensive surgery as, like, for example, to remove the whole reproductive organ, like the uterus, the ovaries, and also the tube. But that will be last in the list. Okay, we try to be a little bit more conservative as possible, unless there's indication to remove everything. So you can see the various range of management when we talk about dysmenorrhea. I hope my ex-medical student is watching this, so it's like a revision to them.
Okay, so basically, the doctors are trying to prevent this surgery as much as they can, if they can prescribe any other type of management. So, talking
Yeah.
about any other type of management, what are the medicine or any type of treatment apart from surgery that the doctor usually did to their patient?
Okay, when we talk about, especially when I see my patient trying to get pregnant, there are certain extra, not just the painkiller, not just the contraceptive pills. There are other so-called little bit high-grade drugs that we use to help patient to control the disease, which is endometriosis, and also the pain basically. If pills, we have Vicen, or it's a progestogen actually designed specifically to control pain for endometriosis patients, secondary dysmenorrhea. And there's another group of drugs, we call it GnRH analog. All right, this is actually we give usually after surgery, all right, in patient with severe endometriosis, just to, in a way, make the disease a little bit status quo, arrest the disease temporary. And based on studies, it can help to reduce the risk of recurrence of the cyst for about 1 or 1.5 years later. Okay, so these are a few other options, but of course depends on the indication. Most of the time, we don't give all this to adolescents. So adolescent, that means our young ladies, we'll take either painkiller, or next step is the COCPs. All right, Yasmin or Yas, or any contraceptive pills.
So,
Oh,
okay, so these two types of drugs are more suitable basically to the reproductive age group, right?
Yes.
Okay, understood.
So doctor, as an OBGYN, how, like, what is the rate of Malaysian women that have endometriosis?
Well, I don't think we really have that, big data in the whole Malaysia. Okay, how many incidents, the prevalence. But to be frank, roughly, I would say 1 or 2 in 10 ladies is having endometriosis. All right.
So it's not
And
as common, is it?
it's actually quite, I think because I see a lot of endometriosis. All right. And majority of my subfertility patient, those having problem to conceive, I would say 70% of them is having endometriosis. All right. So in general, it's like 1 or 2 of 10 ladies is having actually endometriosis.
I see. Okay, doctor, I think we should move on to the Q&A session. So let's read out the first question. When can we start to take folic acid, and how does it affect our body once we consume it?
Okay, who actually asked this?
This is Mrs.
Is it
Fury. Her nickname
again
is
for
Mrs. Fury.
students? Okay, it depends on, to be frank, like I mentioned earlier, keep the 3K. All right, your weight, your lifestyle, and your diet. The 3K. This is the basic element of woman health, and also if you're trying to conceive. Okay, I'm not so into how to say supplements, but the thing about folic acid, for those trying to conceive or those will going to get married soon, and they want to go into very fast conception, like what we call as the honeymoon pregnancy, okay, or baby moon. All right, so you can start taking folic acid as early as 3 months before you plan to conceive. Okay, so it is recommended by the World Health Organization for ladies trying to conceive or planning to conceive to take it 3 months prior to the planned pregnancy. Okay, so depends on the usual dose for those with low risk, patient without diabetes, patient without, woman without diabetes or polycystic ovarian syndrome, they can take the lowest dose, which is about 400 microgram per day. Okay, just small tablet per day. But for those with diabetes, for example, with the polycystic ovarian syndrome, you might want to consider a little bit of higher dose, 5 milligram per day. Okay. How does it
Understood.
affect our body? Yeah. So it has actually multiple functions. Number one, for those trying to conceive, it actually improves the quality of the egg, especially for ladies beyond 35 years old. All right. It's not just for the developing embryo when you are actually conceived. Okay. So it's actually also for the egg. All right. The main source before it becomes fertilized and become a zygote and later on develop into an embryo. All right. So when the baby become the embryo, when the ovum fertilized and become embryo or later on a fetus inside the womb. Okay, so this folic acid will actually prevent the risk of having what we call as what we call that some tubal problem. All right, the neural tube defect we call it. How to say it in layman? mm, some how to say central nervous system problem. All right, so it does help in preventing that. So two
I
functions
see.
actually.
Thank
Mhm.
you so much, Doctor, for explaining that to us. Before we end our episode, do you have any last words to our viewers?
Okay, this is very interesting. I will always how to say give a little bit of tips, all right, for those trying to manage dysmenorrhea at home. Don't forget to keep the 3K, okay, your weight, your lifestyle, and also your balanced diet. Okay, try to keep this in a healthy range. Number one. Number two, home remedy, for example, like hot pad, cold pad, your lifestyle modification, exercise, yoga, Pilates, you can do that. These are actually home remedies for dysmenorrhea. But if you're having very bad dysmenorrhea, scoring more than 5, I would say, please ask your parents to bring you to a checkup. okay, you can go to the general clinic or you can go straight to a gynecologist or OBGYN. Okay.
Okay, with that precious advice, we have come to the end of the show. So I'm sure we have had a lot of fun discussing about period pain, its causes, fact check to the myth, and its treatment. So I would like to thank Dr. Maiza for appearing as our guest tonight. So I hope next time we can invite Doctor to our show again.
Thank you for having me. I'm so honored and I love
Okay, we are
teaching.
also honored to have you. Okay, so for the audience, don't forget to follow IIUMTV's YouTube channel, Instagram, Facebook, YouTube, and Spotify to know more about Girls Out Loud. So next, we have another episode. So see you in the next episode of Girls Out Loud. It's all about girls singing. Bye. Assalamualaikum.
Good night, everyone.
Thank you.